Clinical Laboratory Science. Please take a moment to review the learning objectives before completing this presentation. Clinical laboratory science is basically the practice of collecting patient specimens and analyzing them in the laboratory to provide doctors with important information regarding patient status. According to the federal government, approximately 70 to 80% of all physician decisions regarding diagnosis and treatment are based at least in part on laboratory data. Clinical laboratories are divided into type based on their location. Hospitals of all sizes have at least some laboratory services available. The physician's office laboratory, or POL, may not be a physical space within the doctor's office, but instead encompasses all testing performed within the office spaces, including point-of-care testing, those done at patient bedside. Reference laboratories tend to be larger, more commercial affairs. They gather specimens from a variety of contracted sources and run them in larger groups. Many larger hospital laboratories may also serve as reference laboratories. City, county, and state health departments provide laboratory services and report to the CDC in Atlanta to help track epidemics in the United States. Many laboratories are staffed 24/7, 365, although there may be decreased staffing on weekends and holidays. Many doctors perform morning rounds prior to going to their office hours. Therefore, it's important to get the workload down and run early at a hospital setting. In most hospitals, morning run is completed by 7 or 8 a.m. It's also important to draw timed specimens and to handle stat specimens correctly to provide proper patient care. The Clinical Laboratory Improvement Act of 1988, known as CLIA, is a set of government regulations that were passed to make sure that all laboratories were meeting basic standards for quality assurance to make sure that results going out were accurate. They divided testing into 3 levels: waived testing, moderate complexity, and high complexity. Waiver testing are basically kit tests or other simple tests where an incorrect test result poses little risk to the patient. In many cases, a doctor will note that the clinical condition does not correlate with the test result, or will order moderate or high complexity testing as follow-up. Personnel performing waived testing must simply be trained on the procedure and periodically proficiency reviewed. Proficiency review may simply entail being observed by a fellow employee doing the procedure, or you may be given a specimen of unknown origin and asked to perform it and make sure that you get the correct answer. The chance of risk to a patient from incorrect results of moderate complexity is higher. In cases of labs that perform moderate complex testing, it must be accredited by an accepted accrediting agency, such as JCAH, or Joint Commission for Hospital Accreditation, or the College of American Pathologists, or CAP. The staff will require basic education and preferably certification. In most cases, an MLT or equivalent is preferred. Automated analyzer results are included in moderate complexity testing. It's more than just putting the specimen on and pushing a button. It's important that qualified personnel monitor operation of the instrument and quality control, and watch patient results for suspect patient results. High complexity testing poses a great risk to patients when incorrectly reported. The lab again must be accredited, and the staff will require certification and possible advanced education or training. Most of this testing requires a medical technologist or better, and may require a pathologist for advanced interpretation. Laboratory personnel are divided into a number of categories. The pathologist is a physician who goes through a 4 to 5 year residency and generally specializes either in clinical pathology, which is evaluating the interpretation of tests, or in anatomical pathology, which is the examination of tissues from surgery or autopsy. In many small to moderate-sized hospitals, the pathologist must fill both roles. The histotechnologist requires specialized training. However, a lack of accredited schools has led to an increased use of on-the-job training. A tech may sit for the registry exam after working in the histo lab for a year. Their job is to process and stain tissues for interpretation by the pathologist. The medical technologist, or medical laboratory scientist, has a bachelor's degree in science, often chemistry or biology. They complete a year of clinical rotation and sit for a certification exam. Their responsibilities include education, training, and they may serve as a technical supervisor. The MLT, the medical laboratory technician, or clinical laboratory technician, has an associate's degree in science, including a clinical rotation, and then sit for a certification exam. In this area of the country, MTs and MLTs, aside from supervisory duties, perform much the same tasks, but in other areas of the country, MLTs serve more often as a lab assistant. What follows is a broad description of the various departments of the laboratory. Please keep in mind that testing may vary from site to site, and many of the smaller departments will often be included with the larger departments under a single supervisor. The phlebotomist's job is to draw blood, but in many cases, they are also responsible for helping to process paperwork. Doctor's orders and getting results to the doctors are included in this. Hematology are whole blood procedures. These are primarily cell counts. The main test in hematology is the CBC. For most hematology tests, an EDTA, or purple top tube, is drawn. Urinalysis, as its name implies, is responsible for urine testing. Coagulation refers to blood clotting studies. The primary assays are ProTime and PTT. Coagulation testing is drawn in a sodium citrate, or light blue tube. Serology deals with antibody and antigen reactions. In general, an SST, which is gold or speckled top, is used for serology testing. Chemistry runs a wide variety of tests, most of which involve metabolic processes in the body. Chemistry tests are often referred to simply by number, such as a Chem 7 or a Chem 12. Depending upon the facility, either a serum tube, an SST, which is gold or speckled, or especially in the case of stat chemistries, the heparin or green top tube are used. Blood bank is also known as transfusion services. They process the patient's specimens and prepare products for transfusion to the patient. Generally, an EDTA, either pink or lavender, is drawn, although in some cases a non-additive or plain red top tube is required. Microbiology is responsible for identifying a variety of pathologic organisms. Blood cultures are the only blood specimen generally collected from microbiology, and these are drawn in special culture bottles or in a sterile SPS tube.